Welcome to this webinar on how to become a travel therapist even as a new graduate and repay your student loans in 1 to 3 years. My name is Dr. Emma Shapiro and I am an experienced travel physical therapist, and I am now trying to share my knowledge, my experience, and my advice with as many people as possible. So with that, let's get started in this webinar where you will learn exactly how to become a travel therapist, how to become a travel therapist even as a new graduate, and then how to repay your student loans with this amazing career route. So let's get started. Welcome to this PowerPoint portion of how to become a travel therapist and repay your student loans in 1 to 3 years, even as a new graduate. Once again, my name is Dr. Emma Shapiro. I am an experienced travel physical therapist, and I am here to help teach you how to become a travel therapist. So who is this webinar for? It's for someone who wants to repay their student debt. It's for someone who wants adventure and freedom and flexibility. It's for someone who wants clinical experience and growth, and for someone who maybe knows about travel healthcare and travel therapy, but has some questions and fears and wants more information before they actually dive into this path. So what are you going to learn on this webinar? You are going to learn what is travel therapy, the advantages of travel therapy, the exact steps to get your first travel position, how to travel for new graduates, and why this is an amazing path for new graduates, and then how to pay off your student loans using travel therapy. So let's get started with first, what is travel therapy and travel healthcare? So it is a position that you can travel far or near. You can be a traveler at your permanent tax home or away from your permanent tax home. So you could work wherever you really want to nationwide. These positions are often temporary help. And what I mean by that is that normal travel positions are due to someone going on a sick leave, maybe a pregnancy leave, or just in general staffing shortages, and they just can't hire enough people. So they need a traveler to quickly come and help. Almost any profession can travel. You can be a doctor, a nurse, a physical therapist or an assistant, an occupational therapist or an assistant, a speech therapist, and so many more. And actually, you don't have to even be a medical professional. You can do this as a computer engineer, business administration. So many different positions can travel. Almost any setting is available to travelers. A lot of people think that traveling is only available for skilled nursing positions, and that's not true. You can find acute care, acute rehabilitation, outpatient, home health, skilled nursing, pediatrics in schools, and a variety of other positions. And in my experience, I actually haven't done that many skilled nursing travel positions. I've mostly been able to do acute and acute rehab. So with traveling, you can really go through the specifics of what setting, where you want to work, how long you want to work, how much you want to get paid, and it's very flexible and customizable to your needs. These travel assignments are short term. So often a traveler works 13 weeks at a given clinic or at a given hospital, but this can really vary. Some need an extension, so maybe you're working 13 weeks plus 4 weeks. Some it's 26 weeks. It's really variable, but usually these are short-term assignments. These assignments as travelers are available nationwide. In my experience, almost every state and big city will have travel positions. If you are located in a place where there aren't any travel positions, likely within, say, a 30 to 50 mile radius, you'll likely find a travel position. And lastly, what can you earn as a traveler? On average, as an allied health professional, meaning PT, OT, speech, you can earn on average $1,500 to $2,000 a week after taxes. That equates to $78,000 to $104,000 after taxes. That's on average between 1.5 to 2 times more than traditional new grad positions. Now, I can't guarantee what you're making, but this is the salary that on average I have earned, and also a variety of other travelers and travel companies have reported. So in summary, what is travel healthcare and travel therapy? It is a travel position where you can travel near or far. It is open to a variety of professions, medical and non-medical. They are often 13-week positions, short-term positions, nationwide and in nearly every setting. And they provide high compensation with a potential for tax free stipends. So that is the what is. Now we're going into the why should you travel? What are the amazing advantages, both money-wise, financially, and also lifestyle? So first is the high pay rate. Travelers get paid very, very well. And that comes as a perk in its own, but it's also what you can do with that high pay rate. You can afford to live maybe in a nicer apartment. You can afford the car. You can afford to pay your student loans off. You can afford to save up for a house. You can do a variety of things with your high pay traveler's compensation. In addition to this high pay rate, travelers get many more perks. You can often get bonuses for extension or renewal, or sign-on bonuses to your different travel assignments. You can often get reimbursed or get provided free continuing education units. You can often get your license and CPR reimbursed. It's really up to you. You can talk to each travel company and see what they do and see about those different reimbursements if you're interested. But there are many, many perks in addition to the great compensation. Now, as you are a traveler, you can travel to different locations, and you're probably like, well, that's going to add up in cost. But actually, no, because the travel assignments reimburse you to relocate to that position. So say I'm in Los Angeles and I have a position I want to work in Ohio, and I have to fly to Ohio, I would get reimbursed for that flight to Ohio. Say I chose to drove, well, then I get reimbursed for my mileage and my gas. So there's travel and relocation reimbursement. In addition, if you're traveling away from your permanent tax home, you can get housing provided, or if you want to choose your own housing, you can get a stipend and use that to stay with your parents, stay with your relatives, stay at an Airbnb, get an RV or a fifth wheel, do really whatever you want to with that stipend to live while you're away from your permanent tax home. Now I'm going to move into the lifestyle benefits. So in addition to the amazing pay, which affords you a better lifestyle in itself, you also have unmatched freedom and flexibility. What do I mean by that? With a travel contract, you can choose to work one contract and then take the rest of the year off. You could do 2 contracts, 3 contracts. You can work a contract and take a month off or 2 months off and then work another contract. There is a lot of flexibility with how many contracts you work, and even the number of weeks. You could choose shorter or longer assignments to work. There's a lot of variety and freedom and flexibility with that, unlike a permanent position where you're almost having to beg them to ever give you one day off. So there's so much freedom and flexibility. In addition to that, you are literally getting paid to travel the nation. What I mean by that is that the travel companies will pay you to relocate to your assignment. Then they'll pay for your housing at the assignment, your food at the assignment, because you get a housing stipend as well as a meal stipend. And then you're getting to see all the different amazing sights, the picturesque mountains, the trees, all over the United States. You can travel and really get paid to do what you love as a therapist or a healthcare provider, and also travel the nation and have adventure and see these amazing sights and have these amazing opportunities. You also have unbeatable experience. So in my opinion, traveling is great for building your resume and your confidence as a clinician. You can work in one setting like acute care, and then the next 13 weeks work in outpatient. So you're able to keep all your skills up to date. You're able to grow more skills and various skills and have confidence being able to see almost any patient. And not only is it about seeing different patients, but also working with the different health professionals, getting to work with different directors, different supervisors, social workers, wheelchair clinicians, a variety of different people in each assignment that is going to build your wheelhouse of information and clinical skills to make you more amazing as a healthcare professional. So in summary, there are both amazing financial and lifestyle advantages to traveling. There's the high pay rate that can afford you a great lifestyle in itself, as well as help you pay off your student loans. There are bonuses, continuing education reimbursement or free continuing education units. There's the license reimbursement. You have the unmatched freedom and flexibility, the ability to get paid to travel the nation and have adventure and see the sights, and also create an amazing experience that helps you grow as a clinician. And if you choose to return back to the permanent sector, you will be valuable and sought after. So I hope that has pumped you up for the next phase of this webinar, which is to provide you with the exact steps to get you started. So here are the exact steps to start your travel healthcare career. First, we got to talk about your requirements. So this is the requirements for allied health professionals. You have to have graduated from an accredited program, be licensed in at least one state, and you can also be working towards that license as well. Be good standing. What I mean is that there's no red flags on your license, you're not in any legal trouble, etc. And then you can have 0 to 2 years experience depending upon profession. So nurses are more stringent. They more stringently require you to have 2 years of experience. But as an allied health professional, we're a little bit more flexible. And as a new graduate without any experience other than your internships, you could potentially get a travel position. Now, I have to be straightforward with you and say, yes, it very much does help to have 6 months to a year of experience. Many facilities look at that and like that and prefer that, but there is such a demand for travel positions. There are so many positions that need to be filled. The patient population is growing and they need healthcare workers. And so even as a new graduate, you can find a travel position, especially if you have an amazing resume and you are an excellent interviewer and have great communication. So those are the requirements, and now here are the exact steps to obtain your first travel assignment. So step 1 is to secure an amazing travel company and recruiter. So your travel company and recruiter, they contract with various hospitals and clinics, and they help to find the jobs. So they're the people that are going to be job hunting for you and finding the jobs that you want, and then coming to you and trying to see if those fit your needs. So it's extremely important to have a great travel company and recruiter because they're phase 1. They're getting the job. And so with that said, I, at the very end of this webinar, have a free mentorship program that includes 3 amazing recruiters that have a variety of different skill sets so that you can start traveling confidently and comfortably from day 1. But once you have your travel company and recruiter, then you simply complete the required forms. And that's very simple. It only takes several days. And that's simply your resume, a skills checklist, some references, your W-2 for be paid, variety of different things. After you do that, you're going to talk with your recruiter and let them know what you want in your ideal job. And I really want you to emphasize your goals when you talk about your job search, because I think that's where some travelers fail to succeed. So when you talk about your goals, you want to try to choose an ideal travel job that does the following: that meets your clinical and career goals, that meets your lifestyle goals, and that meets your financial goals. So once your recruiter gets that information and they search for ideal jobs for you, they're going to come back and say, hey, I found this perfect job for you. It's here, it pays this, it starts here. And if that appeals to you, and if you think that is a great position for you, your recruiter then will apply you to that position. So this is the nice thing about traveling, is that it's very hands-off. You simply just have to communicate with your travel company and recruiter, and then they basically do a lot of the work. So after you apply to these positions, and if those potential facilities like you, then you will get an interview over the phone. That's about 15 to 20 minutes. That goes over some common questions that you can ask the company as well as what they would ask you. And that would entail, like, how do you overcome conflicts? What are your strengths and weaknesses? What are your goals? What typical populations do you see? What's your current caseload? Variety of different things. And then on your aspect, it would be sort of the similar things. What's your caseload? What are the duties? What are the productivity demands of this? Do you have a need for travelers? Am I going to be guaranteed 40 hours or get called off early? All those different questions. And if you want to know those exact questions, stay tuned to the very end, because I'll be going over my free mentorship course and program that gives you all the talking points that you need to become a successful traveler on day 1. So say you interview and you get that position and the facility really wants to work with you. You review the contract that they've provided and you confirm the position and you sign that contract. And then simply you start working on that expected date. It's that simple. This whole series of it could be maybe 1 to 3 days. That could be how fast you could get your travel job. or it could be 2 weeks. It really highly depends upon your flexibility and your openness. The more flexible and open you are, and you have to maintain your standards, of course, but the more flexible and open you are, the easier it will be to find traveling positions and the quicker it will be to start traveling. So I know that was a lot of information. So here is a review and a summary. So step one is to research travel companies and try to pick out one that really meets your needs and your goals. Within that travel company, secure your perfect recruiter. That's someone who's going to be honest, upfront, proactive, hardworking, and a great communicator. Then you complete the required application, which I said is very easy. It's just a resume, a skills checklist. Takes you just a couple days max to fill out everything. You talk with your recruiter and you finalize your job search, and your recruiter then sends out that information and looks for positions that match with your needs and your goals. If you find a position that matches and that position actually wants to interview you and get to know you more, you get to do a 20-minute phone interview to make sure that it is a match for you and also for that facility. Then you negotiate and confirm your contract, making sure you have all the dates, all your vacation days, the pay is there, everything looks good. And then you simply come into work on that required date and start working. Now, after that, it's actually very simple. You can continue to work at that same assignment if you want to, and if there is a need, or you can change contracts. So within the same company, they would simply do that job search again and try to find another amazing contract for you. Now, that could be a contract within the same state or the same city or a whole nother state. It's up to you. It's very flexible and it's really based on your needs and your goals. So now to the most important question, can new graduates travel? And the answer is yes, 100% yes, new graduates are actually in a great position to travel, and I'm going to explain that now. So traveling for new grads is really great for a variety of reasons. One, you can find your ideal setting. I don't know about you, but when I was a new graduate, I really didn't know where I wanted to work and I didn't know what setting. I was sort of a generalist. And so with traveling, I was able to trial a lot of different settings, and that was able to grow my experience, grow my confidence, and also know that I really liked treating geriatric patients. So for you, you may not know the type of patient you want to treat, or maybe you think you do, but maybe you're not confident with that. So this allows you to trial a lot of different settings really easily, really seamlessly, making sure you like a certain setting before you really settle down in that. Next is that even within that setting, you may not know what kind of director you like to work with. Do you like to be micromanaged or macromanaged? Do you like a certain productivity? Do you like a certain schedule, 9 to 5, 8 to 4:30, weekends, etc. So not only is it about finding your ideal setting, but also your ideal work environment. Next is that this can really build your career. As a new graduate, when you graduate, you really only have your internships, and that's not that much to show when you're trying to apply to different positions. And so traveling can really build your resume. I mean, you can say that you were a director or that you worked in a level 1 trauma center. You can put amazing things on your resume that you've done with traveling that you wouldn't be able to do in any other career path. And that not only builds your career in the fact that it builds your clinical experience and your knowledge base, but it also builds your resume. So when you exit traveling, if you want to, and start a permanent career, I know many people that actually segued into directorship positions or into positions where they actually made higher than they would normally just because of traveling. Next is that maybe as a new graduate, you don't want to settle down in just one spot and you want to have some adventure, have some fun, see the sights. Maybe you're not sure if you want to settle down in a certain state or another state. It's a great way to see different locations, experience adventure, experience flexibility, be able to work and have holidays and have vacations and really be able to have a nice lifestyle. Because you get paid higher, you can take advantage and take some more time off and have a better lifestyle. And then lastly, but not leastly, and there's so much more, is the ability to pay off your student loans. Many new graduates are graduating with over 6 figures in debt, and with a traditional job only paying you $70,000 after cost of living, after loans, you're really not earning anything. And so with traveling, you can actually get paid what you deserve and actually earn so that you can either save and build a nest egg for maybe a house, for your college, for your child's retirement or your child's tuition, and so many other things. Or you could, on the flip side, pay off your student debt. So there's really a lot of flexibility when it comes for new graduates. And I think this is a great opportunity because if you're a new graduate trying to become debt-free, you need to tackle this from day one because interest accrues so rapidly. And so as a result of that, if you can tackle it from day one with an extremely high-paying position like traveling, you can actually save yourself $10,000 to $20,000 in debt just because of interest saved from earning more and paying your debt off faster. So lastly, and most importantly, how can travel therapy help you pay off those horrible student loans? And once again, you don't have to use travel therapy to pay off your loans. Like I said, you can use this to build your nest egg, to build your retirement fund, to save up for a house or a car, so many different things. But if your goal is to pay off your loans, this is my number one recommendation for a career route because what I said, it's great pay, it's adventure, and you really don't have to sacrifice. If you were to work in a permanent position, you really wouldn't be earning anything. So the way that you would pay off your loans would really be to sacrifice. It would be to budget, to eat minimally, to live minimally. And yes, with traveling, I also encourage you to do that so that you can pay off your loans as fast as possible, but you don't have to sacrifice as much because you're earning so much more. And that's exactly what I'm going to do in detail right now, is show you how much more as a traveler you would earn. So I talked about the range that travelers get. They get between $1,500 to $2,000 a week after taxes on average. Now, once again, I can't guarantee this, but this is like a typical range for allied healthcare professionals. So if you work 52 weeks a year, that equates to $78,000 or $104,000 that you would have earned as a traveler after taxes. Now let's break down a permanent position. So often a new graduate, and even some people working several years, are earning $70,000 a year pre-tax in an allied health permanent position. After taxes, I used various tax calculators. That's about $52,000 after taxes based on a single individual. So $52,000 compared to $78,000 after taxes means that at least you earn $26,000 more as a traveler. And that's not including those bonuses and those reimbursements and just the overall interest that you're saving in student loans. You earn at least $26,000 more, even if you get paid that minimal amount of $1,500 as a traveler. That's the low end. This could be even more if you got paid that higher end as well. What does this mean in terms of your loans? Well, if you had a $100,000 loan, that means that you would actually pay off your loan 26% faster with traveling than any other position. And I'm not even including, like I said, those bonuses, the other reimbursements that you often have to pay as a clinician. And there are other perks beyond this. So just your loan, you could pay off 26% faster as a traveler. And that's at least 26%. It's pretty amazing. And that's dramatic. That's dramatic when you think about how much interest is accruing. That's almost a whole year. If you were to try to pay off your loan in 4 years, that means that a whole year faster you would pay off on a $100,000 loan. But can traveling get any better? And my answer is yes. I have worked really hard to find amazing recruiters and amazing travel companies so that I can help provide as much amazing opportunities to healthcare professionals. And so I'm really excited to share with you that I have found a company, an amazing recruiter that helps you get an additional $2,000 per contract after your first 2 contracts for your student loans. So that means that compared to any other travel company, this company actually pays off your loans 20% faster. So in addition to that regular 26% faster, this would be another 20% faster. It's pretty cool. So I hope you have learned a lot in this webinar, and I hope I've provided a lot of information and really helped you understand what is traveling healthcare, the advantages to traveling healthcare, both financially and lifestyle, how you can travel as a new graduate and some of the advantages that it would offer new graduates compared to permanent positions, and then how you can use this to repay your student debt. So I want to decrease the barrier to entry to this amazing career route because it has changed my life, and I know it will change yours too. So I have created a free mentorship program that includes the following. It includes a free call or calls to answer all of your questions and concerns and really get you on the right path. After one call, you still have questions, you can call me again. You can write me an email. You can Facebook message me. A variety of people, if you ask them, they'll tell you that I communicate usually within 24 to 48 hours and get back to you with a really detailed response. In addition to mentorship and guidance, there is a free course I have created for you. This course is 2 hours. It's online. You can access it anytime for life. It is yours. And it covers all the nuances that I didn't get to today. So it covers houses. It covers licenses. It covers organization. It covers step-by-step talking points and checklists. You know, how do you interview for the perfect assignment? What do you ask the perfect assignment? How about what do you even ask your recruiter? All of that is in this course so that you can really be successful on day one. And then lastly, I also have found 3 amazing recruiters that provide you with a variety of different perks. There's one company that has a structured clinical mentorship program. There's one company that has a structured student loan repayment program where after the first 2 contracts, you get paid $2,000 a contract after that for your student loans. That's huge. That's 20% more than any other travel company. And then there's another company that has like just a great overall total package. And yes, they have another perk where you get an amazing all-inclusive vacation as well after 3 contracts. But these 3 recruiters in themselves, besides the perks that I just mentioned, are amazing. They are extremely responsive. They are extremely honest. They are proactive. They are hardworking, and they communicate well with you. And that's what you really want to be successful. So I think I have provided everything you need to be successful upon day one, and it's all for free. It's a no-brainer. So if you want to sign up to get started, and once again, if you just want my recruiters, you can have that. If you want the mentorship and then the recruiters, you can have that. You don't have to talk with me even if you just want the course and the recruiters. Whatever you want, I am extremely flexible. I am here 100% to help you succeed in this career path. And you don't have to be a new traveler. You can be a seasoned traveler as well and talk to me about how to improve how you are traveling as well. So if you are interested in my free mentorship program, you can sign up using the link below. Just click that link and sign up, and then I'll get back to you and we can see what you need, and I'll try to help you as best as I can. In addition, if you still have some more questions, or if you don't want to use the link, you can also sign up by emailing me at debtfreept@gmail.com. Or if you have more questions and you want to sign up as well, you can go and Facebook and search me. I'm on Travel Therapy 101 Facebook group. My name is Emma Shapiro, and you can find me and you can private message me and we can talk through all of that as well. I hope you've learned a lot with this webinar. I hope that you are able to become more successful and free yourself from debt or start on the path to financial independence as well. Thank you so much.